So Pakistan has recognized for a very long time that it faces a number of serious crises with water. They are not simply one of a shortage of water. That is the case in some parts of Pakistan. In other areas, it's waterlogging, it's salination, flood controls. There are just, in short, no end of different water crises going on in Pakistan. Some of these are mirrored in India as well. So across South Asia, we are facing possibly existential crises of life or death related to water. Now, the parts of Pakistan where you don't have fresh water supply, people rely on groundwater. They are increasingly digging tube wells. They're going deeper and deeper into the ground, so they're facing risks of heavy metal contamination, so arsenic poisoning, which of course has again dire health consequences. We know that the water table has dropped significantly over the last 20 years. We know that the consequences of the shortage of water also lead to serious problems of soil erosion, which affect fertility, which means agriculture is compromised. We know that millions of people in the country have no access to clean drinking water. We know that even more millions of people in the country have no access to clean sanitation. These are not simply inconveniences. These are life or death problems facing Pakistanis every single day. And GB is also part of this kind of wider Pakistan water crisis, but it's not like other parts of Pakistan. They have a very different water crisis. They have water. What they don't have is a means to get the clean water to people's homes. That's where WASEP, the Water and Sanitation Extension Program, and AKA, the Aga Khan Agency for Habitat, stepped in with a scheme which is ostensibly about water, but really it's about people. It's about organizing people to organize themselves to manage a vital resource that we all need. And in this case, it's water. In other cases, if we could get this right with the WASEP schemes, then who knows where we could apply it. But we could apply it to any number of really quite vital, basic utilities that human beings must have, where there isn't a sufficient profit motive for a company to step in, and there isn't sufficient resource or organizational ability or skill for the state to step in. Where can people fill that? Where can the kind of that civil society step in and satisfy the needs that people have? This, that hierarchy of needs, food and water being right down there at the ground. How can we get the civil society to fulfill some of those needs in a sustainable way? And I think maybe, Jeff, this is where you could come in and talk a little bit about the management. I mean, how?
Well, it's interesting because Steve says it's about people, but when we talk about sustainability, ultimately it's also about financing, because without the funding, you can't maintain systems. So one of the big problems we have, the whole idea of community-based water management, which is the model for the Water and Sanitation Extension Program we're looking at, is that it's one thing building the water infrastructure. It's another thing maintaining it. So it's no point investing millions and millions of dollars building something and in a couple of years' time they stop working. We are now at this stage of our project where we are finally analyzing the data that's come in and looking at the figures and looking at whether these individual projects, we're looking at 50 WASEP projects, rural and urban, whether they're actually financially sustainable, whether they can undertake, they collect enough funds, enough tariffs, contributions from the community to undertake regular maintenance, or whether they need to ask for help either from the Aga Khan Agency for Habitat or from the state to cover the cost of larger repairs. These communities in turn contribute monthly, that's the idea anyway, they contribute monthly tariffs to cover the regular maintenance that comes up. And those tariffs, in order to ensure that it is affordable, that no one's denied access to water, tend to be low, and they don't tend necessarily to cover all the costs, which is one reason why the private sector hasn't stepped in. because there is no profit in delivering water to especially poor communities, because you can't charge the sort of cost-covering tariffs needed to cover your actual costs and to earn a return on your investment. This is where community management steps in between public delivery and private delivery to try to see if there's a middle ground to address the problems associated with both public and private. I guess to go back to the question of whether this can be scaled up, I think, putting on my economist hat, it depends on the money. I think if there's sufficient funds and we can budget for life cycle of a project, which includes not just the pre-stuff, the actual construction, and then the post-construction support, maintenance, training, retraining, etc. If we can do all that, there's a possibility that it can be scaled up. But of course, the $64 million question is the money.
And I mean, if that money could be found, this is a remarkably cost-effective way of delivering a vital utility. So I think, I'm actually optimistic that this might be a strategy that the Pakistan government adopts, or that even the WHO adopts, as sort of recognizing that there is an imperative for Pakistanis to have clean drinking water and clean sanitation, because if they don't have that, then we are facing something rather dystopian and unthinkable.
Well, and of course there's this economic cost to that. The cost of lost days of work, the cost of medical bills for households, and in fact that was one of the main reasons many communities, villages applied to be part of WhatsApp. So they approached the Aga Khan Agency for Habitat and said, we want to be part of this program, because they realized that even if they had to pay regular tariffs to maintain the system, it would cost them less than their medical bills in the year. So the idea was that actually this made a lot of sense. And we have to remember that the key difference with AKAH's, with the Aga Khan Agency for Habitat's water, is that this is drinking water. This is a drinking water scheme. So you can stop at any tap stand, which is part of this WhatsApp, and you can have a glass of water, and it's totally fine, straight from the tap.